know that cervical cancer is the leading cause of cancer-related deaths among South African women, and it's the second most commonly diagnosed cancer, excluding basal cell carcinoma. Let's dive into some essential information and explore the different aspects of cervical cancer today. So what exactly is cervical cancer and how does it develop? Cervical cancer starts in the cervix, which is the lower part of the uterus leading to the vagina. The most common cause of cervical cancer is infection with human papillomavirus or HPV. It is a common virus spread through sexual contact, body fluids, and skin-to-skin contact.
Cervical cancer is one of the common cancers in South African women. So the cervix is the mouth of the uterus. So every woman has a uterus, and then it starts off by being the uterus, and then at the bottom part we have what we call the cervix. That is the opening of the uterus. The cervix has cells, and therefore when you develop cervical cancer, that cancer will affect those cells that are on the cervix.
Let's talk about the common symptoms of cervical cancer and how they typically manifest.
Women will start noticing pain in the lower abdominal area, and that is outside of your menstrual or menstruation cycle. And then periods that last longer than usual or are heavier than usual, abnormal discharge, and this discharge can be foul smelling or it can be just a discharge that just smells normal, but you need to get it checked out. And then later on, when it has now spread onto other parts of the body, you can start feeling generally sick.
The Pap smear or Pap test is a common screening method that can detect abnormal cells in the cervix. Early detection is key to successful treatment. If an abnormality is found, it's crucial to follow up and start treatment promptly. Women should begin Pap smears between the ages of 18 and 20 if sexually active, and screening is recommended every 3 years.
Pap smear is a gentle swab on the cervix, whereby we swab for the cells that are on the cervix to see if there are any abnormal cancerous cells. And also what other people can do is go for an HPV test, whereby they test if you have the HPV virus, of which it's one of the viruses that causes cervical cancer.
To reduce the risk of HPV infection, vaccination against HPV is highly recommended. Vaccination between the ages of 9 and 14 is most effective, and boys can also benefit from vaccination. Besides HPV, certain lifestyle factors can increase the risk of developing cervical cancer, including smoking, alcohol consumption, obesity, and lack of physical activity. Women with HIV are also at a higher risk due to a weakened immune system. When it comes to treatment, options vary depending on the stage of the disease. Early detection allows for less invasive treatment and a higher chance of survival.
There are 3 different types of treatment options. It can be surgical intervention, whereby they remove the cancer itself or the organ that is affected, or they can do chemotherapy, or they can do radiation, or they can combine either or of the options. Can be chemo and radiation, or surgery and chemo, or surgery and radiation. So it will depend on you as a person. When you go into the doctor's room, they go see where your cancer is, and your health profile as a person can determine as to which direction they take in terms of treatment.
After treatment, follow-up care is essential for monitoring recovery and catching any signs of recurrence early. Regular follow-ups with healthcare professionals can make a significant difference in outcomes. Let's remember that awareness and prevention are key to combating cervical cancer. By understanding the risk factors, prioritizing screening, and taking preventative measures like the HPV vaccination, we can make a significant impact in the fight against cervical cancer. Let's continue to spread awareness. Take care.